At this time, I just want to reassure you that we are being very vigilant in everything we do as far as cleaning rooms, wearing masks, following all CDC guidelines, and we would not be offering in-person visits at this time if I was not completely sure that your safety is utmost.
As your physicians at Lake Cumberland Medical Associates, we have prided ourselves over the years of taking high quality care of the patients that have chosen us to be their physicians. We encourage you to continue to come see your physician when you need to see your physician. If you need an appointment, do not hesitate to call us. We will do our best to see you that day or as soon as possible. We want you to continue to get the quality health care that you've received for the years that you've been coming to see us as physicians.
I've been asked, is it safe to come see your primary care physician at this time? And I just want to address some safety features that we have in place. We have full-time staff here that all they do all day long is clean. They wipe down elevators, they wipe down doorknobs, they wipe down exam rooms, and nursing staff after every single patient encounter does a complete clean and disinfecting of that exam room before another patient is placed in that room. So yes, it is clean and safe to come to your physician's office.
It is very safe for you to come to Lake Cumberland Medical Associates to resume your health care. We are following CDC guidelines regarding safety for both the employees and for our patients. You can come and see your physician without fear of acquiring coronavirus, and we will provide the utmost health care as we have in years past.
At this time at Lake Cumberland Medical Associates and at every practice in physician services, patients are screened at the front door. They're asked a series of questions about exposures to COVID-19 travel. They are asked if they have a cough, respiratory symptoms, or fever. They're immediately masked before proceeding. If they have an infectious disease or are sick, they are admitted to a different part of the building. They do not come upstairs where well child visits and well examinations are taking place at this time.
Even during these trying times, it is still of grave importance that our children are kept up to date in terms of immunizations, so that if they're exposed to anything else in the environment, they can fight that off more effectively. So we encourage all of you to still maintain your appointments and keep your children's immunizations and their health up to date.
So please come in for your visits. Now, do not wait until July to try to do your school or your well child visit, because there will be a rush at that time. It's much safer and will be easier for you to get your child seen now for well child and school physicals.
So when your children come to the clinic, the first thing that you will see is a nurse that will take your and your child's temperature just to make sure that there is no temperature. They'll ask you a series of questions to make sure there's no evidence of any type of an infection or anything like that. And then once that's done, you'll get on the elevator and come up to the appropriate floor and be seen. If a child is old enough, they'll usually have a mask placed as well as the parent, just for precautionary measures. In our clinic, we are practicing block scheduling, which means that we are keeping well child checks separate from any other visits that we might have. This decreases any chance of any problems or anything's occurring. And we're also trying to keep patients spaced apart so there's not any or very little overlap in terms of one patient and another patient interacting with one another.
On the Family Medicine Clinic on the second floor of our building, we are resuming visits as before. You can come in for regular routine visits, for well child visits, and we highly encourage you to come in for your school and well child visits now.
At this time also, we're offering telemedicine services for patients that do not physically need to be in the office. If you do not require x-rays, lab work, immunizations, etc., then it's probably appropriate to do a televideo or a telephone visit at this time. Those are offered. You just call like you would for a normal appointment. We will schedule a time to call you back and provide adequate services during that visit. At this time, if you're bringing a child for an appointment, or if you're bringing an elderly person that needs care, you are allowed to come with that patient. We fully expect you to do that. We will mask you also. We will check your temperature also, along with the patient that's being seen.
If you're an adult, you can have one visitor accompany you for your visit. If you need to bring your child to be seen for whether a well child or a sick visit, one parent or adult may accompany that child for the visit.
At this time, because of the COVID illness, your experience at Lake Cumberland Medical Associates may look a little different. We are socially distancing in our waiting rooms. We are using masks in all patients. We're asking patients to come alone, or if they need a caregiver, to bring one caregiver with them. But let me reassure you that your patient experience and your care will be exactly the same when you go upstairs at Lake Cumberland Medical Associates.
I think one of the worst things you could possibly do as a patient now is to put off coming to the physician if you need to see your physician. Don't wait until you have an emergency to be seen. Come in for your preventative and routine care, get your medicines refilled. Don't put things off just for the fear of the coronavirus. We are not going to expose you to the coronavirus at our office. We are doing everything we can to ensure your safety and to put you at ease in seeing your physician.